Today I'm going to be demonstrating the diagnostic ultrasound of the supraspinatus. The supraspinatus passes above the glenohumeral joint. Its origin is the supraspinous fossa of the scapula with an insertion on the greater tuberosity of the humerus. Its main action is abduction of the arm. This is necessary for that initial 0 to 15 degrees of abduction. It also provides stability to the glenohumeral joint. This muscle is innervated by the suprascapular nerve. As you can see here, there is an anterior and posterior view depicting of the supraspinatus. For your patient positioning, you want your patient to be seated and upright. You want their arm to be placed posteriorly with the palmar aspect of their hand on the superior aspect of their iliac wing. Their elbow is flexed and directed posteriorly. For the clinicians, you want to ensure that the transducer notch is facing towards the patient's right. The first thing you want to do is put the gel coupling medium onto the patient, and then ensure that you are, like I mentioned, have the transducer notch facing towards the patient's right. You then want to move the diagnostic ultrasound until you are able to differentiate between the varying structures. You would like to do this in two different planes. You want to have a view in both the longitudinal and transverse plane. Here you can see a still from the transverse scan of the supraspinatus. The supraspinatus is located between the deltoid and the humeral head. One way to differentiate between these structures is the supraspinatus is more hyperechoic than the deltoid. That is one way to differentiate between this tendon and the muscle. Another way to differentiate is the deltoid, being a muscle, has more of a starry night effect. You can locate the humeral head below the supraspinatus, and this can be seen as reflexive because bones are reflexive. On an ultrasound, where you will see the top area of the bone is very bright with darkness below it. Here is a still from the longitudinal scan. You can differentiate between the supraspinatus and deltoid in the same way, where the supraspinatus is more hyperechoic, so it will appear brighter. And then you can locate the acromion, also having that reflexive image similar to the humeral head. Our main take-home point is that proper shoulder positioning is crucial and allows for easier visualization of the supraspinatus during diagnostic ultrasound. According to Faruqi et al., the diagnostic accuracy of ultrasound compared to MR for supraspinatus strain detection has a sensitivity of 89% with a specificity of 73%. This then provides us with a positive likelihood ratio of 3.30 with a negative likelihood ratio of 0.15. This then lets us know that diagnostic ultrasound is not helpful at ruling in supraspinatus strains. However, it is moderately helpful at ruling out supraspinatus strains.